Results are coming in for Mr. Doe, so now it's time to review them. The first clue you will have to a new result is a yellow or red star appearing to the left of the patient's location. A yellow star means a new result is available, whereas a red star means a new critical result is available. On the tracking board, under the lab column, you will see two numbers: the number of labs ordered and the number of labs for which there are viewable results. If a check mark instead appears in this location, it simply means that all ordered labs have viewable results. Mouse over the lab section to see the status of each of the labs. Dispatched means ordered, collected means the blood has been collected by the nurse or phlebotomist, and in lab means the sample is inside the lab is being processed. Completed means there's a viewable result. If a lab is taking longer than normal, you can use this information to see where the holdup is. Double-click the labs to view them. Note that on the top bar there is a date range which is limited to a short time frame. To view older results, right-click that date bar, click Change Search Criteria, and change the clinical range. For instance, changing 2016 to 2014 will give you all the results from June 10th, 2014 to June 16th, 2016. In this case, Mr. Doe doesn't have any older results. Once you have viewed all of Mr. Doe's lab results, you can click the Review button. This will mark all the labs as reviewed. Marking the labs as reviewed also clears the star from the tracking board. If you do this consistently every time you review lab results, every time there's a new star, you know that there's a new result. The radiology column next to the lab column is for radiology and has three numbers: the number of studies ordered, the number of studies with viewable images, and the number of studies that have finalized reads. Again, a checkmark icon in this area means all ordered studies are finalized, and you can mouse over the area to see the status of each of the studies you've ordered. In this case, there is one radiology study ordered, our chest x-ray, and the one in the middle column means that there is one x-ray viewable. To see the image, double-click in the radiology box, then double-click the study of interest. Click the green easel button to open the PACS system and open the x-ray. The EKG column is for electrocardiograms. If there's a viewable ECG, double-click it to view it. Prior ECGs will be displayed as tabs along the top of the screen, so you can compare prior ECGs to this encounter's one. If you're a provider responsible for reviewing ECGs preliminarily to ensure it's not a STEMI, you can put your interpretation in the text box at the top and click ED Review and close. Rounding out other items on the tracking board, the Nursing Comments is a text area where nurses can write messages to us or to keep track of things for themselves. The MD Comments is a text area where providers can put in important reminders to themselves. We will cover the ADT column, which stands for Admit, Discharge, and Transfer, when it's time to decide on a disposition for Mr. Doe. Another way to review results is inside the chart itself, using the Vitals, Nursing, and Results screen. Open the patient's chart, then navigate to the tab on the left that says Vitals, Nursing, and Results. The default Flowsheet tab compiles most of the patient's data on one screen. Again, be aware of your date ranges and remember you can change them by right-clicking on the date bar and changing the clinical range. If you wish to narrow down what's displayed, use the subsequent tabs along the top navigation bar. The Lab tab only will display labs. The Diagnostics tab will only display imaging studies and EKGs, and Vital Signs will show all the recorded vital signs, and Microbiology will allow you to see prior culture results, which can be incredibly helpful for patients who have been hospitalized to screen for resistant organisms, which may change your antibiotic selection. Now that you have all the information you need about Mr. Doe, you need to document the encounter by writing a provider note. We'll cover that process in the following video.